Have you heard how important chiropractic is in your pregnancy? Hi guys, Dr. Lester here, and today I want to talk to you about pregnancy and chiropractic. It's actually quite a big deal because a lot of your pelvis is moving at one time, so it's important to keep it in line as much as possible, and also to help relieve a lot of your symptoms like sciatica and back pain. Those are super common, and just to help mom be as comfortable and stress-free as possible. So the first one is going to be, like I said, pelvic balance. Keeping your sacrum balanced and in line is going to help with sciatica, step one, but it's also going to help with the low back pain, and it's also going to help keeping the motion of the hips together as you walk and whatnot, because there's a lot of hormones going and things are moving and a little loosey-goosey. So we want to make sure that the sacrum stays in line because that's a big pain generator. Another one is your pubic bone. So the pubic bone is the front of your pelvis, and it moves a lot as well during pregnancy, specifically because you got this big belly that's forcing you forward just a little bit, and it's forcing that pubic bone to tilt a little bit forward. And when it's time to deliver that baby, it should be a little bit easier because the pelvis is moving and not as stuck as it might have been otherwise. One of the things that we definitely talk about to help with that is going to be the exercise ball, right? This is going to actually be really important because it helps you kind of rock that pelvis during pregnancy, specifically if we're trying to prevent low back pain and trying to keep that pelvis moving. So we highly encourage the pregnancy ball, really for any back pain and whatnot, but for pregnancy, it's a great one. When you are pregnant and you do come in, we have these pillows, and this pillow has this nice little circle in the middle, and that's for your belly, and it's also for baby when baby comes, but it has multiple pillows for depending on how far along you are, and these are covered in high density foam that help keep you comfortable and your belly nice and safe during an adjustment. And also a lot of women like it because they get to lay on their stomach for a second without all of that pressure. We also use pregnancy pillows regularly if we're doing other things like acupuncture, e-stim, or whatever to help your system relax. We will use pregnancy pillows so you can lie on your side comfortably during that time. We also offer, of course, prenatal vitamins. There are things that we want to supplement appropriately, and we have some awesome ones from Orthomolecular, which I definitely encourage you to check out. I definitely like to talk about intuitive eating in general. Your body knows what it wants, and listening to your system during this time is going to be super important because you're feeding yourself and someone else, of course, as well. So making sure that you are listening to what your body needs during this time. On top of that, staying hydrated. Not enough women do, but you actually need a little bit more hydration during this time. But staying hydrated is going to be pretty important, especially because you're peeing a lot because things are pressing on your bladder. So hydrate with water plus electrolytes to really help balance that system. Enough protein is going to be crucial because you're having a baby. What's the main building block? Protein. So it's going to be super important for you to have enough protein to help give baby the best structure possible. This one I actually think is really important. It's kind of, I guess, the woo-woo side of things, but emotionally healing is pretty important, I think, during this time because you don't want to keep passing along some of these generational things that keep going on and on and on, or some of your own issues that you've experienced, your own traumas. Let's not pass this on to this new little life, let's not pass those stress hormones and all those chemicals on. So I think spending time to really heal yourself, deal with your shit kind of thing, I think it's really beautiful and helpful for that next generation. And then, of course, I think it's important to really plan the what ifs because a lot of women are really, really stressed out about their birth plan. And if you have a plan for all of the things, at least it covers those bases. So, for example, I have a plan if my water birth doesn't go well, or if my doula gets sick, or if my midwife calls in, or if my doctor broke his arm or something. And I have backups. I know what the worst case scenario looks like because then I don't have to worry about it. usually I feel like when you plan for it, it doesn't happen and your best case scenario ends up happening. So I highly encourage you to plan out all of the things, have those conversations in advance so you don't have to worry about it as you get closer, and you can really be in that moment and enjoy your pregnancy. I hope that helps. We would love to be part of your pregnancy journey. You can contact us at 210-756-9020, and we look forward to meeting you. Thanks, guys.